welcome to the B Team Podcast. I am your host, Josh Safran, with my co-host,
Matt Mars,
and our permanent guest,
Rob Nelson.
We're here every week to talk to you about all things Bentonville, bourbon, and business. The B Team Podcast. Be here.
So I got a question for you, right? So let's talk about our large friend group, right? There's someone on the skinny shot. There's someone getting hormone replacement, whether it's, 3 different ways you could do it,
sure,
or 4 or 5 or however many there is. And then there's people on peptides and all that kind of stuff. What's your take on those? Because in our age range, if you're not doing it, most likely someone who is.
It feels like he's talking about himself.
Well, in the friend group.
He's talking about the majority of males right now. I mean, I'll tell you right now. So, I mean, those are absolutely great topics. And,
good job.
Come on, man.
Yeah.
I add value.
Yeah, I add value.
Did you slip him that question before we came in?
There's...
I mean, I could actually have a conversation about just throwing bombs at each other. Intelligent conversation.
That was intelligent.
Yeah. That's why we brought you on.
Yeah. That's why the viewership is always higher when I'm on.
Yeah, that's true.
Okay. Are you never not on?
Yes. Sometimes I just don't show
What a
up.
mistake. Oh, I see.
I'm like, no, I'm not going to go today. Just to piss off Josh.
It's it's complicated. Again, it's like our bodies are complex. Sure. My treatment plan versus yours would be different. The hormone's a perfect example. So what I would say is there are significant...
What's Salt's philosophy on those 3 topics?
Did he say philosophy?
He did.
Yeah.
Well, some doctors or some, organizations, they don't support some things and some do.
I just didn't know you knew 4-syllable words. That was impressive.
I know a real good 4-syllable word for you. 4-letter word.
So I'll do hormone first.
Okay.
It's a good example. So we certainly want to meet you where you are, and we would want to verify with testing what an actual deficiency or need would be before making any recommendation for treatment. So we do multiple different hormone replacement therapy options at SALT. So we are supportive of that. With that, again, caveat of we need to do an assessment and we need to see where you're at. Take your other health factors.
You're just not going to throw some pellets and just
not just going to throw them in.
Yeah, because Angie would really like Rob to be tested because she feels that it's too much. That he's getting
too many minutes.
She wants it throttled back a little bit.
Throttled back. Shout out to Angie.
So, but the thing I'll say that's unique about hormones, because it's become pretty controversial, where it's like, oh well, if these pellets are bad, or this cream is bad, or any replacement is bad. There are significant numbers of studies that show that it's extremely harmful if you continually run at an extremely low testosterone level. And so you kind of have to balance. Again, it's like if your quality of life is terrible and you're going to be at risk for other health complications because you never address anything for your hormones, then that's terrible too. So you have to balance what works well. And again, there's got to be a cardiovascular risk done. There's got to be, do you have other autoimmune issues, other things that need to be a part of your care team. So all those things are personalized.
So all seriousness, you better use your membership.
But in all seriousness, instead of just doing the pellets, because this should be a holistic summary of everything going on to figure out if the pellets are going to go well with other things.
Absolutely. Right? Yeah. And we want to do, interval testing as well. So we do peaks and troughs and try to see where your highs and lows are with the absorption of the pellets, for instance. And that's just one example.
So you do pellets.
We do pellets. We do cream. We do injections.
In essence, he wants to know if you do pellets.
I ain't giving up my pellets.
Rob's like, check.
Well, it's funny.
What about the other things?
It's funny. There are people who, it has literally transformed their lives. You have some where it's like, I felt a little bit. Others, but there are individuals who would, 65, 70 years old, and they're doing jumping jacks saying, I love pellets. So, it just depends. And again, it's where you're at in your health journey and all the other impacts of factors that you want to look at. But absolutely. And so same thing, with some of the GLP-1s and different things like that. We're 100% going to talk to you about your diet, lifestyle.
Right.
We have a health coach on site. She's going to help partner with you and work on, okay, well, let's make sure we're addressing as many things as possible. And then, we'll discuss if there's an option of something that might make sense for you. Obviously, the quick fix is usually not a good solution.
No shortcut.
It's not a fix. And so they usually create other problems. So a lot of people, it's like, just give it to me now. And then they don't recognize that, a few months down the road, that there may be other factors that are impacted by it. So again, we want to look at it from a holistic, whole body, where you at in your journey of your health cycle, and you want to go from there.
So is this a place that, as a member,
yes,
we could go we would go every day. I do the gym, I do the sauna, even if don't have a doctor's appointment.
Yeah,
this is a place. Do you have people coming every day?
Oh yeah.
Okay.
Come use the fitness center. Again, you can just work out. You can go to one of our classes. You can go to use our personal trainer. You can get a massage. You can get a facial. You can go to the spa. You can go to our locker rooms, well appointed. We really treat it more like a country club. It has everything you need. It's got not just
the feel of that.
It does. The razors, the shaving cream, the deodorant, everything's there. The point would be is if you wanted to meet your wife for dinner, go start working out at 5, get some sauna time, get cleaned up, meet her at 6:30. And
you do like a good sauna, Josh.
Yeah. I love a steam. Yeah. Do you have steam in there?
We have steam.
He does.
Yeah.
I love a good steam.
I actually prefer the steam too. Most guys like the sauna, and I like it. Don't get me wrong, but there's something about that steam. We get that eucalyptus oil in there, and I'm loving it. So so it's definitely a community. We have members who are very diligent, and then we have others who are like a gym. It's like, they come once a month, or forget.
We have to start coming more often.
Yeah,
we got to start doing that. And what's the price of membership? Can you? Is it?
So our individual rate for a month is $349 a month, and again, that's up to 20 medical appointments a year, as well as the access to the facilities. We offer for families. We love families. Perfect example: the 2 individuals you guys want to sign up, you're each going to pay $349. But a family, individual and spouse plus 2 kids, is that same rate, that $699. So it is really
$699 for family.
Yep, it's like getting 2 kids for free.
Now, if you have 3 kids or 4 kids or 5 kids, or
you pay an additional rate per child. That's I think $70 extra per month.
So we could be like the B team family.
No, same household. Same household.
We live in here. We live together in here.
Say if kids are out of the house.
Yeah, so
it's
if they're over 18, then they'd be an adult, but they would get a discounted rate. So that individual.
But I'm just saying, say if it was just Angie and I who wanted to sign up.
Yeah,
then it's just $349 times 2.
It'd be $629. So there's a break for having 2 adults. And actually, the best thing is, I also say this because it's like we're the opposite of like DirecTV. They like sign you up for $99. The next thing you know, you're paying $200 and you don't know how. Starting the 13th month and beyond, that rate actually drops from $349 to $279. So there's a savings as you move forward, as a continuity of care. And so the reason we did that is we have, again, that functional medicine piece. We have people come to us and they say, hey, I heard you do functional medicine, and I have had 20 years of extreme, XYZ, and I really want to figure this out. And we'll spend 3 appointments with them and give $20,000 worth of care, and they can quit membership at the end of the year potentially. And so for us, we said, there's a reward, an incentive for people to commit. And
that's probably why you have a wait list so long, because people don't leave. Why would I leave?
The reason we have a wait list even more so than that is, this is the perfect example. So if you sent Angie to me and Angie came and became a member for 6 months and you didn't sign up, she would sign you up. So every time we have openings, we fill them with just existing customers who are family members. So in fact, we'll be like, okay, we've got 10 spots available this month. We didn't offer a single one to someone outside because they all got gobbled up by.
So if you add another doctor, the wait list would go away quickly? I mean, is that the thinking?
Over a period of time. I would say 6 to 9 months, because we definitely want to integrate that new physician into our practice.
So by the end of 2026, you should be able to be.
You already said we were going to exchange numbers, and he was going to get us in.
So are you guys with this new physician? Are you guys looking to open another location? Or are you going to
Good question,
Matthew.
Yeah. So first of all, we don't have anybody signed yet. So
because it would be hard to your location now.
It's awesome.
Well, and what everything you have in that building, it's like you took us on the whole
tour was amazing. Every room you went into, you got better and better. Like, what's next?
I know. Like before the end, I was just like, take my money. Like it's an amazing.
Yeah.
I know Rob and I talked when we left.
Yeah.
We should have.
We both.
And then when we did,
we went on the
it was already full.
Well, like I said, you got to hook up if y'all let me know.
But I think it's I love the whole idea of it.
Yeah.
So I can't remember what question you asked me because you.
I don't remember.
Second location.
Oh, second location. Okay, so we are recruiting another physician. We don't have anybody signed yet. We have been talking with a couple people, and we're excited about that. But we get asked all the time, okay, when are you going to open another location? Couple things. One, man, franchising in medical is like super hard. So, there's all sorts of challenges with medicine in general, but Arkansas specifically has like some corporate practice of medicine laws. It becomes very complex. And so we're getting ready to launch our version of a solution that will allow people to partner with us through an affiliation program. And we have, 2 or 3 docs that we've already got kind of in the queue that we want to offer the opportunity, and they would still be able to independently own and operate, but have a network connection and support from us through an affiliation program. And so could we go run another and operate another Salt Health? Absolutely. If I did it, I probably wouldn't do the full-blown facility that we did here. I'd do it probably on a smaller scale and have this kind of be like our flagship facility for Salt. And then maybe have a clinic in Fayetteville with a smaller, maybe a sauna and a small gym, but not the full-blown, smart 2,000 plus square foot.
So if you bring on another physician, would it potentially be at your current location where you could see more patients?
Right. Yeah, definitely. So we have the capacity in our current space to be able to grow. But we're looking at both. So we would prefer to bring somebody in and also get some of these affiliate partners.
Can you imagine your drive down Walton during the day? You'd stop at the sub shop, you'd stop at the fish guy, you'd stop at the gents place, you'd stop at the car wash shop, you'd stop at Salt. It'd be amazing for you. Right? I mean, that's your day.
We love our location. Like when we were looking, we actually looked down here in Pinnacle several years ago. And we were pretty excited because you can see it's amazing. And from a real estate investment, it probably would have been the best move. But we were concerned that people from Bentonville wouldn't want to come down. And so it is real. It is real.
That's why same thing. We had an opportunity to put the gents place down this way.
Yeah.
And we wanted to be in between Pinnacle, Shadow Valley, and Bella Vista, downtown Bentonville. And that's why we picked that location.
Yep.
That exact reason.
And you've got, 2 good roads, Dotson and Rainbow. That can kind of connect where you don't have to go through Walden. And so for us, it was a good combination to be able to access Rogers and Bentonville. And again, it's in a little medical community. I mean, obviously there's the Hershey's building, there's your place, Jen's place, which again, you already said it. I am a member of, multi-year member, love the Jen's place. You're welcome, Emily.
Yeah, Josh had nothing to do with it.
0, less than.
But it is a great location. I mean, there's a great, women's clinic right by us. There's a dialysis clinic. There's, of course, Premier Dermatology, brand new GI clinic, and soon to be outpatients.
But you wouldn't think about that area as heavy medical, and then you start to layer all those things. There's a lot going on back there.
There's a lot back there.
Yeah.
Well, it's real close to Northwest.
Yeah.
And so as you go down to the intersection with the Krispy Kreme, you can turn left and go to the hospital. That's real close to us, and so there is actually quite a bit of medical in that area. So it was a perfect fit for us. We love Fountain Plaza, good access, and we're kind of tucked away enough. You can turn off Walton and see us right down the road as you're coming through, but it's more of a private, parking lot and access point for our members. So,
Jordan, the question for you: if a world-class 52-year-old male athlete.
Oh boy!
No, I'm asking a question.
Or
had an accident and tore his ACL and MCL. Would you guys do stuff in that type of space, or would you end up having to say, "Hey, you even get into those types of things and surgeries and other things?" So, and I'm not saying me specifically, but if it just happened to be that type of world-class athlete on the tennis court, just curious what
he'd give you some peptides to shoot into.
He even said specifically which sport it was.
He's like, I would go ahead and recommend you go to pickleball.
Because my process to get,
I assumed he was already.
This gentleman's process to get from diagnosis to surgery was awful. Do you guys do anything?
So obviously the need for specialists is always going to be there. So again, kind of going back to Matt's point, the old traditional primary care is that's where you start. So that's your starting.
So would that individual come to you guys on the primary care and say, hey, take a look at my name?
So we actually have X-ray on site. We have lab on site. So for us, it's an opportunity for us to initially diagnose the problem. And then again, we're your primary care team, so we become your referral source. So if you want to get in with an orthopedic after that, or you need to based on our evaluation, then we have the relationships to be able to direct you in the right place.
That would have cut a lot of time.
Oh, you would have saved
months,
so much time.
Months. Yeah.
Yeah. Well, money, pain, months, whatever you want to call it. But
time is money.
Yeah. And cardiology is a perfect example. Of course, there's going to be times where you need to, see a cardiologist. We're going to do an aggressive workup before that, though, from the cardiac standpoint, so that you're not just, you've got high blood pressure. Okay, you need to go see a cardiologist. Okay, well, let's figure out what's actually going on. Let's see if there's things we can change. Let's take a stab at actually diagnosing it. And then if we need it to be managed and be referred to a cardiologist, we'll do so. So again, it's more that old school. Let's get to know our patient. Let's get to know what's going on in their life. What are the things that are driving, their success? What are goals? We truly have people that are elite athletes, just like you, Josh, and they say,
he just signed up for 5 years.
They say, I run, 50 miles, every weekend. I just want to be 3% better. We have members like that. And then we have others like, man, I have something going on. I'm only 35 years old and it is impacting my ability to go to work. And so it's everything in between. And for us, optimizing your health, no matter what that means, and if it's different for you, for me, you, then that's okay. But we'll meet you where you are in that journey and help to optimize it. And maybe it's a 5% improvement this year, 10% improvement next year. But it's, again, sustained over time, not a immediate fix. Cover it up with a pill and then move on.
And that's what I love about it. Because you have a nutritionist and you're like, let's get you doing everything right before we throw a bunch of medicine at you to try to,
which can cause other side effects and so on.
But that's what I love the most about the model is we're running 1,000,000 miles an hour.
Yep.
There's so many things going on. I would walk in there, you put me on, this is what you should be doing for your heart. This is what you should be doing for your exercise. This is what you should be doing for your diet. And you've given me now a full new regimen. This is how much sleep you should be getting, right? This is, you need to be working out this much, more cardio, less cardio, whatever the number is. It's a one-stop shop, and then you help us implement it. As opposed to now, you're going here for this, you're going here for this, you're going here for this. You're like, I don't know what I'm doing or should be doing. And then you read, you shouldn't be drinking, coffee without dairy in it. You should be not eating after no sugars, no. I don't know what I'm doing. Everybody's telling you something different. Eat this, don't eat this.
Every week it's different.
Yeah.
Well, what's nice is what he said, and not even to dog on the medical field just because it's so huge, but the right hand doesn't talk to the left hand. So you go to one guy and then you go to another place and it's a whole nother story. Whereas you guys it's the same little group you're talking.
And that's going to be my next question. So Matt's point, when you refer someone out to a cardiologist,
sure,
the person, say I go see the cardiologist, do they understand I'm coming from SALT and that the approach that you take?
Yeah. So, they would receive documentation that included our initial assessment workup and what our plan of care and action would be.
Right. But do they actually appreciate it?
Some do.
Right.
In fact, it's pretty cool.
They kind of partner with you. They get what you've done and.
Yeah. So, I will say, again, a lot of them are stuck in that traditional system and structure and have been for a long time. But there's absolutely docs all the time who are I love what you're doing.
Right.
I had a Mercy doc who reached out a couple weeks ago.
I wouldn't want to go be referred. Yep. I'd want to go be referred to someone who was I support your approach.
Absolutely. And there are plenty that do. There was a cardiologist in Oklahoma City that I worked with quite a bit, and I know his practice philosophy from a diet exercise was more along the lines of what we want to do instead of just, okay, well, you know what, as long as you're on this pill, you'll be okay, whatever else may be. It's the mindset again is, are you wanting to cover up a problem, or are you wanting to actually reverse it, or put yourself in a position to eliminate it completely? Yeah. And so the specialists, there are some awesome ones in Northwest Arkansas who I think do really appreciate us. It's awesome. We went. I had a patient show up one day. he wasn't a patient yet, actually. He came for a tour. And I said, how'd you hear about us? He goes, I was in the ER at the hospital last night. I was like, oh my gosh. I was like, what are you doing here? And he said that
I was dropping off my sister.
He said the ER doc told me to come check you guys out. Some of the stuff that was going on. And I was like, sweet,
that's amazing.
I was like, that's amazing.
And those are the kind of members you want.
Yeah,
they get it.
Yeah,
they'll never leave you.
Yeah, and so it was one of those deals. I was like, man, I wish I knew the doc's name. He didn't know,
Yeah,
but it's one of those deals. So it is more widely accepted. But again, when you're in that structure and you're daily just grinding, having that many patients, do you take the time to be like, oh, this is a Salt Health patient. I'm so excited they're here and look at this workup they've done. I don't know. Yeah. Probably not to some degree. But again, we require, of course, to get the notes back so we can integrate it with the care plan moving forward. So if you do go see a cardiologist, then, we're going to know what's going on with your care and still be involved in it. And if we, have a recommendation, then we'll send that as well, and we can work together. Right.
Yeah, thinking through this, I think a potential barrier for somebody coming to you would be it's expensive on top of my insurance.
Sure.
And thinking out loud, well, I got the $20 Netflix thing on top of the YouTube membership, on top of the 5 times I went out to dinner last week, on top of the pair of sneakers I bought that I don't need. And you go, all of a sudden, it's pretty easy to find efficient savings that could prolong your life.
Yeah.
So it's one of those things where you start putting pen to paper what you're spending crap on now versus I'd rather spend this money here, even though it would be a cost above and beyond my insurance. Yeah. It really does make a lot of sense when you start to look at how you're spending your money today.
Man, I always say, not to knock it because, life is expensive right now. Anything you do, it's like, oh my gosh, I cannot believe how expensive this is. You prioritize what you want to prioritize in your life. We have people who come and complain who are driving up in the very nicest cars, and I know they're making $500,000 a year, and they're complaining about our membership rates. And then I've got somebody who is a school teacher or somebody who has a small business with 4 employees, and they're prioritizing, and they're saying the most important thing for them is to prioritize their health.
That's right.
Yeah, and so it doesn't, and I'm not judging it either way. I don't really care. But my point is you can find the money to prioritize, and we also we find a way to help some of those in need. We have a mission and a heart for that as well. So we've got a great scholarship program.
Matches her discount. Matches her discount.
Not for you. But it is. We do recognize that price is a pain for a lot of people. It's a pain point. And so we've tried to make it as affordable as we can. And what we believe in is that you're going to get so much value that you're going to forget about the price. And we actually just in November did a survey of our members, and we had our highest participation ever from a survey. I was thrilled to see how many people had done it. And 91% said the value was excellent or greater than they expected. And that they that same 90 and a half, I think was the second one, was that they plan to be a member 2 years from now.
Wow.
And to me, I'm sitting there like, man, that was the greatest compliment we could have, because you're always worried about retention, right? Because you don't want to have somebody who's here today and gone tomorrow.
So let me ask one more question on that same topic, because again, it comes down to if I'm currently paying into a health insurance plan, I could come in and say, hey, Jordan, my 2026 insurance here is you'd help me figure out what I needed to remove or pull down or reduce that would allow me to still keep my insurance plan, but then free up some savings to come over to you. Is that something you guys could?
So you're getting a little dangerous on me there. I don't know that I want to.
I would touch it.
I don't want to make that recommendation. Just if you want my personal opinion, as far as could you and I have that conversation? Sure.
Yep.
Somebody who comes in, I have no idea what your health history is.
Well, because you're feeling, let me just back up. You're feeling like I have to have the most premium max insurance policy because the company, you look at it, this gives me this, and this. But I don't know if I need the this. I may just need the this.
Yeah.
I don't need all the other stuff.
Yeah.
Right? It's just, I just don't know. So it's one of those where, could you help somebody? What do you don't agree?
No, because I mean, you're taking on so much responsibility. I don't think any business owner would do that.
Yeah, I mean, it's more of from an official company response. We wouldn't necessarily do that.
Yeah.
But we do have people that we could
Because
refer
the
you
minute
to.
he says this and it goes the other way, it's his fault.
No, that's good.
But again,
I just don't know.
From a conversation of just us, like I mean, again, having bourbon one night at the gents' place. Yes, we can definitely have a conversation.
But unofficially, you can do that. But officially, you wouldn't recommend.
But no, because again, there's so many factors that go into it.
No, that's fair.
With your family risk, with your history, with all those different types of things. Even if you told me I haven't hit my deductible in 10 years, the 11th year it's going to happen.
No,
so I mean, and the odds do kind of roll that it's like 1 in every 4 years or something. You're going to hit that. And so you definitely want to have, and I don't know your finances, I don't know all these different types of things.
They're not good.
Your
Yourself.
aversion to risk, all of those things.
I do have a lot of risk.
So, but I will say, what we do want to be involved in is helping you make decisions to prioritize your choices in your care. So, you could come and be a member at Salt Health and have those up to 20 visits a year and just pay flat the monthly fee and never a penny more. In doing so, if we recommended a test or an advanced diagnostic or something else like that, and you didn't want to do that, that's fine. We can still do it. The ability to kind of be investigators and detectives and find out what's really going on, the more information, the better. So most people obviously do some testing because you want to see what's going on.
But that's included though, right?
No. The testing, we give it like what we call member discounted rates.
Okay, got it. Okay.
So, and I'll be careful with the shout out here, but I'll still use the example. So Quest.
Shout out.
We love Quest. Like they help us. We have a great relationship. We have what's called a client bill relationship with them. So if you came in and we drew your lab at Salt Health, then we would charge you a cash pay price for that lab test. And then they would bill us to process that lab test.
Okay.
The cost that we're going to charge you is going to be infinitely less than you going to Quest and running it through your insurance. And there's a ton of reasons why, but the most simple one is I might run 300 labs or more in 1 month, and so they can bill me as one client and know I'm going to pay them. They don't have to track down insurance, co-pays. They don't have to call collections, all these different types of things. And so it might be an $800 lab test at Quest if you've never met your deductible, and it might be $200 at Salt. So
that makes sense.
We have that discussion with you to say, hey, you don't have to do this test. If you want to do this test, you can go to Quest, run it through your insurance, or we can draw it here. We'll get the results back in X amount of time, and then it will help us provide insight into what's going on. Perfect example is there's a digestive health test that we've probably done more than any other, and you guys can Google it, whatever it's called, the GI map, and it's an active look at, it's a stool sample of your digestive health. And so as you look at that, you're going to get a multi-page report back. You're not going to know what to do with it because there's so much information. But our team, I knew I shouldn't have brought it up.
Jordan, I don't know what to do with this. I don't know what to do with this.
That was pretty good. You look healthy.
You mail it. Don't bring it back. Don't bring it to the office.
That's what you do.
Don't bring it to the office. Yeah.
Rob diagnosed with a stool too. We just give him a bag. It looks good. $25. Good. Looks healthy.
But that one test is going to give you insight to what's actually going on in your gut more than any test you've ever done, I promise you. And so you may not, if you feel like
gut's important.
If you feel like your gut health is fine, then you don't want to do that test. But if it's something like most of us that are in our 40s or 50s, if you're being honest with yourself, you probably have a little more digestive problems than you'd like to admit. And so is it a good opportunity to say, where am I? What does it look like? And can I make some changes that might dramatically improve how I feel? Then yeah, it's worth the advanced test cost that we have. And you can, that's an example of something for sure. Like if you have a HSA, for instance, then that is a diagnostic health test. We'll print you the receipt and you can submit it to your HSA.
Got it.
How about IVs? That's a additional.
Same thing. Look at your HSAs as to whether it would be, but yes, it's again member discounted rates. Everything we do, I'll give the perfect example. In fact, we're going to have to raise prices because the community has gone crazy on this with like massage therapy. So our member discounted 60-minute massage was $79 right now.
That's a good
Dude, I'm telling you, not going to knock anybody, but there is a new massage place here locally that is a 50-minute play for like $159, and they charge extra for you to use the sauna or steam and things like that. You get a day pass for $79, or even as a non-member can come get a massage and get a day pass for $99 and get a 60-minute hands-on massage with sauna, steam, and the fitness.
Can you lock Matt and Rob and I into the price before the price goes up? Because I'm trying to get our membership.
I mean, it'll still be lower because we're committed to truly doing that member discounted rate. Yeah. And so whether it's personal training, whether it's massage therapy, whether it's IV therapy, it's going to be cheaper than where you're going to go in town, but there's still cost associated with that. Some of those might be $10.99, like contract employee.
What does an IV run typically?
So it depends.
On average.
Yes, on average, 120 to 130. Some can go up to 150 depending on the medication. Some can go up even higher. There is like NAD.
That's with the member discount?
Yeah, with the member discount. And so, but that might be, 2-3 different medications, nutrients in it. And so it just kind of depends. But ultimately, you can go again and pick a cocktail somewhere and it's going to be, 180.
Yeah.
One of the things I love is like, perfect example is taking your health history again. So you have your medical record there at SALT. I had a kidney stone last year and a half ago, first time ever, and the urologist, I don't even know if he's right, but it was one of those, he was like, it's the most common type, might avoid, high dose vitamin C. That could be something that calcifies and results in that. I was like, oh, that makes sense. So I kind of verified it looked good. Well, I would get IVs at SALT and get additional, high doses of vitamin C.
Right.
So like now I know it's in my chart and my team knows that like I can get some, but I don't need to get the additional boost of vitamin C. So that's an example of where, again, because it's your care team.
Well, you're changing what your routine based on this.
That's like what Matt said. I mean, now the left is talking to the right.
Exactly.
Where today it doesn't.
I like that.
And so, and again, I was with a member earlier this week, and it was awesome.
Wasn't you?
We wanted to.
Wasn't.
No.
We know he wasn't with you.
It could have been one of us. We can't talk about it. It's a secret of value.
I mean, it's medical.
Hey, exactly. It's
Doctor
HIPAA.
Doctor patient. HIPAA rules.
Yes, HIPAA. Yes.
Shout out to HIPAA.
But I was able to quickly. They said, well, they recommended I might, get a free consultation with the personal trainer.
I think I'm gonna give up my locker at the Jen's place, then I could just transfer the money over to this.
Rob's gonna sign up as soon as we finish.
I can't let you store this there.
No, I'll just use Matt's locker.
Okay, perfect.
Or get the free stuff under the counter.
That's perfect. It's a good fit.
Yeah. I mean, it'll be practically free then.
Yeah.
Jordan, we love you. Thank you for coming in. Can you do a website, Instagram, Facebook page, TikTok? Like share with the viewers how to come find you?
Yeah, sure. We're most active on Instagram and Facebook. Salt Health NWA on those. Salt-health.com for our website. And I did mention we have 8 or 9 podcast videos we're getting ready to load up, make available for the community. We've done snippets that we've kind of shown on our social media, but we've got some amazing content from health coaching, from dietitian, my own personal, again, where I kind of looked at the structure and system of the health system. What is functional medicine? Dr. Herbst, our nurse practitioner, Jacob, who's amazing. He's doctoral and nurse practitioner. He's, been an educator and trained others. He's got 4.5 years now of functional medicine experience, certified by the Institute of Functional Medicine. They've come on, done multiple podcasts. So it's great content. It's fun. They're not stiff at all.
Anytime you want me to come onto the podcast,
Permanent guest.
More than happy to.
Yeah, we may do that.
He's a permanent guest.
I would be happy.
Testimonial.
That's right.
Yeah.
That's right.
Well, you have to have Matt or I come.
Yeah, I need an actual member.
We're members.
I can't.
You mean a paying member? Not a freeloading member.
Or an existing one. Yeah,
exactly.
Yes. One that's
Here in a minute, Rob's gonna be like, "I'll pay twice. Just give me in and make sure they're not."
Don't get me wrong. I think I met.
So you take Amex Black?
Yeah, exactly.
I think I met Angie that night, but I would say, I would definitely prioritize her before you.
Yeah, that's fine. Yeah, exactly. That's fine. Oh, she was mad at me because she put us on the wait list. And we finally got called, and I was just starting to finally get myself on track on a few different things. I'm like, well, just give
off.
me a little time because something's actually.
Oh, so they called you to get off the wait list?
Oh, you got on?
And then
we got on.
You passed?
And we passed.
Now you're at the bottom of the list again.
And that's okay.
Once you pass, they put in the shredder. It's like, oh, you're still on the list.
This isn't Blakeman's.
We tell people.
I'm joking.
Obviously,
Ben, we love you.
Sorry, Ben. I don't feel that way.
When you get on the wait list, you get an opportunity to get an invite like that.
Yeah.
But if the timing's not right, it's all good. I mean, it's one of those deals. And so what we do is we keep in touch. We keep you on the list if you want to stay on the list and get an opportunity in the future. But yeah, we're definitely.
She was mad at me.
Can you let the viewers know how far down the Nelsons are on the list now? Can you pull it up on your phone?
If I had known, I would have looked beforehand. I'd have been
I don't see a Nelson.
I don't see Nelson.
They might even have a
She was
star.
mad at me.
Do not return call.
Yeah. She was like, "Are you sure we're passing on this?" I'm like, I just like you know when you finally feel like you're yeah.
And we all go through stages. I mean, there's been times.
I've never done that.
I've been.
I signed up immediately.
Thank
you.
Hey,
Matt likes staying on the list.
I didn't get to finish. I was too busy chatting with you.
Hey, congratulations. Thanks for everything.
Hey, thank you guys. I appreciate being here.
Thanks
You
for
guys
the
are awesome.
membership and the fellowship. The
fellowship,
we have. Brotherhood. Maybe we can bring Rob in one of these days.
On a guest pass.
Yeah.
Yeah.
I'm fine.